Hi everyone, my name is Maria Hamill and I am the Learning Programs Coordinator with Veterans Upward Bound, and today we're going to be going over living with chronic pain. So we're first going to go over what is chronic pain and some statistics associated with chronic pain, as well as 4 different categories of pain management and a community resource. So start off with some chronic pain stats. More than 50% of veterans receive care for chronic pain. This is according to Practical Pain Management. So whether that care be physical therapy, through medication, surgeries, etc. So that's a pretty high statistic to see. As well as the U.S. Department of Government Affairs states that chronic pain is more prevalent and of greater intensity in veterans than it is in the general population. So as you can see in this graph, that is for sure true. So this graph is from the U.S. Department of Health and Human Services, and you can see on the left there it says percent with severe pain, and it's sectioned out by male versus female. And then within the male and female, it's sectioned out by veterans versus non-veterans. So if we're taking a look at the male category, you can see that veterans versus non-veterans experience severe pain by roughly 2% of an increase. So that's pretty big. And then this is super interesting. The females, veterans versus the non-veterans females experience severe pain by roughly 1.5% increase. But you can see here in this graph that the females are reporting that they're experiencing more severe pain than the males, which I find is really interesting, and I'd be curious to see more studies done on this to why that is true. But next we're going to jump into what exactly is chronic pain. So chronic pain lasts for 3 months or longer, and it impacts an individual's quality of life by affecting their daily activities such as sleeping, socializing, working, etc. And it also affects their mental health. So some common forms of chronic pain from Iraq and Afghanistan veterans include joint pain, back pain, musculoskeletal pain, and there's some more, but that's kind of like the overall general sense of it. All right, so now we're going to go into 4 different categories of pain management. So pain management itself is treating the cause or the source of the pain and then finding ways to alleviate that pain within the body through these 4 different categories. First category is traditional options, psychological interventions, alternative medicines, and lifestyle management. So we're going to go into each of these and dive a little deeper. The first option is traditional for pain management, and these include interventions such as injections, surgeries, or devices to help alleviate that pain. So when I think of devices, I think of like a knee replacement or a hip replacement, as well as like other external devices such as wheelchairs, walkers, etc. There is also the physical and rehabilitation approach, and this is accomplished through exercise or physical therapy or other therapies or rehabilitation approaches. And lastly, an option for pain management is through medication, such as like pain meds, like oxycodone, etc. But it is important to talk to your doctor about opioid addiction. By the study of Substance Abuse and Mental Health Services Administration in 2015 found that veterans it's still remaining very high, that opioid addiction within the community. And they found that 5% of veterans needed help ending addiction from opioids such as oxycodone, hydrazone, methadone, morphine, fentanyl, etc. And there is also a high link between opioids in veterans in pain management and suicide. So it's very important to talk with your doctor about opioid addiction and the different resources and treatment plans that are available to you. Next up, we have the psychological interventions associated with pain management. And these are a little bit different than what we were just talking about with the physical. And I found that these were kind of cool, so I wanted to definitely include these. And something that you often don't think of when it comes to pain management. So, first up is hypnosis. So, hypnosis is accomplished through guided sessions from a licensed therapist or hypnotist, and they usually last for about 10 to 20 minutes. And the goal of hypnosis is to help manage the fear and anxiety related to pain. So, a lot of people that do go to hypnosis, they find that it does help reduce pain. So, I found this statistic from arthritis.org that finds that 75% of people with chronic pain found that during hypnosis they experience significantly reduced pain. So, if that's something that you want to give a try, it might be something to try out. I know that many different insurance companies are looking into covering hypnosis, so something to look into. Another psychological intervention includes biofeedback. So, biofeedback is using your mind to become more aware of what is going on inside of your body. So, an example of this would be, let's say I have severe back pain. Using the biofeedback technique, you are going to focus on relaxing the muscles in that painful area and realizing, this is a painful area, and then trying to alleviate it using your mind and your body. So, different techniques of biofeedback include deep breathing, mindfulness, muscle relaxation, etc. And it's performed by psychologists or general physicians. And this was just kind of a brief overview of biofeedback, but there are lots of nuances within it, so that's something to look into if you're interested in that. And then there is also talk therapies. This is more a broad approach over psychological interventions, but that is also an option for you. Next up, we have alternative medicine to pain management, and this includes acupuncture and mindfulness. So we'll go into each of those. Acupuncture is applying needles, heat, and pressure to certain points on the body to redirect and alleviate pain. So this is accomplished through inserting thin needles inserted into the skin. So you can see in this diagram or this photo here, it's putting little needles into different areas of the skin, and this is accomplished through an acupuncturist who knows where those pain points are on the body and how to redirect it. There is also mindfulness as an alternative medicine. So mindfulness is the basic human ability to be fully present, aware of where we are and what's going on, and not overly reactive or overwhelmed by what's going on around us. This is according to mindful.org. So mindfulness is used to help cope with chronic pain by helping decrease stress associated with that pain. So there's lots of different techniques and lots of things that we could talk about for a very long time in regards to mindfulness that I don't have time to go over today. However, I did go into a very in-depth workshop on mindfulness, so I encourage you to take a look at this workshop. It is on our website as well as on our YouTube page, which is Veterans Upward Bound GVSU. And I really dive deep into mindfulness with this one, so I encourage you to take a look at that workshop because we just don't have time to go over it today, and there's a lot to it. And last category of pain management we'll go over today is the lifestyle management. So this is making sure that you're getting and having a healthy diet, so getting enough like fruits and vegetables or nutrients that you need to help keep your body healthy, as well as getting enough sleep for your age. I don't know about you, but if I'm ever have a painful part of my body, helping to get plenty of sleep sometimes does help the pain. It doesn't take it away altogether, but it does make you feel a little bit better. Also important to lifestyle management is making sure you are keeping up on your spiritual needs if that is something that's important to you. And very last part of lifestyle management is getting enough physical activity. So I know what you're thinking. You're probably thinking, I'm really painful. I don't want to be doing any physical activity or exercise at all. However, getting enough physical activity does help you keep your joints moving and it helps you keep your muscles strong, which in turn can help alleviate pain. Also, getting physical activity does have mental health benefits. So, when we're moving our body or getting enough exercise, our body does release endorphins, which help you feel, which are like the feel good hormone, which helps you feel better, as well as helps decrease your cortisol levels, which is your stress hormone. Lastly, maintaining a healthy weight as part of physical activity is important. Um, Having extra pounds on your body or not having enough pounds on your body can add to the pain, so it can help with pain management. But it is important to note that we don't want to overextend ourselves when it comes to physical activity. Make sure that you're determining your pain level and your fitness level. So, if you're super painful, I don't think it's a good idea to be going out and running a marathon. However, it is a good place to start to try to do some low impact activities such as Tai Chi and yoga. So, it's a good place that I would recommend to start at. I also wanted to include a really cool resource through the MSU Extension. They have a chronic pain path series, which is a 6-week session where you meet online via Zoom, and this session is supposed to be for people who experience chronic pain, and it will help you learn tools on how to manage your symptoms. It is free and it is all online, so I will include the link in the directions page, but I encourage you to take a look at it. It might be helpful for you. As always, if you have any questions, concerns, or want to talk more about pain management and living with chronic pain, give us a call or shoot us an email. Check out our website. We're here to help. Thank you. Hope this was helpful, and have a great day.